So, skin. General anatomy of skin. Skin is the largest organ of the body. Skin is the largest organ of the body which occupies about 1.5 to 2 square meters. So it is the largest organ of the body. Okay, skin is the largest organ of the body, which occupies about 1.5 to 2 square centimeters. So the skin consists of epidermis and dermis. Epidermis and dermis. So epidermis is the avascular layer. Epidermis is the avascular layer, and the appendages present in the epidermis. They are nothing but they are sweat glands, sebaceous glands, hair, nails. They are present in the epidermis. And coming to the dermis, dermis is a vascular layer. Dermis is a vascular layer which consists of blood vessels and lymphatic tissues and also some connective tissue fibers. Okay, so epidermis consists of, it is a vascular layer, and the epithelium of the epidermis, it is nothing but the stratified squamous keratinized epithelium. The basal cells are columnar cells. The basal cells are columnar cells, and we have 3 to 4 layers of polyhedral cells. And what happens here is, here the cells become flattened here, and later on the cells, they get dyed and occupied by keratin. Okay, the basal cells, we call it as stratum basal cells. The stratum basal cells, outer 3 to 4 layers of polyhedral cells, we call it as stratum spinosum, and outer to that we have stratum granulosum cells are present. Stratum granulosum cells are present, which is nothing but the flattened cells. And outer to that we have the epithelial cells. What happens here is the epithelium, as we are going upwards, the epithelial cells, they get destroyed. Okay, so we can't see any nucleus here. So we call this layer as stratum lucidum, and the outermost part, it is the outermost part of the epithelium, it consists of keratin. This one we call it as stratum corneum. Stratum corneum. Okay, so the epidermis consists of 5 layers. It is an avascular layer, and the appendages of the skin, they are seen in the epidermis. That means their appendages means hair, nails, sweat glands and sebaceous glands. Okay, they are seen in the epidermis. And coming to the dermis, dermis, it is consists of blood vessels. It's a vascular layer present beneath the epidermis. It consists of blood vessels and connective tissue fibers, and consists of lymphatics also present in the dermis. Okay, and next one is the superficial fascia. Beneath the dermis we have skin and fascia. Okay, beneath the dermis you have superficial fascia. Beneath the dermis we have superficial fascia. Okay, so this superficial fascia consists of some blood vessels, nerve plexus are present in the superficial fascia. It consists of connective tissue fibers, and it consists of some subcutaneous muscles. Subcutaneous muscles also present in the superficial fascia. So the superficial fascia, it is present beneath the, the superficial fascia, it is present beneath the dermis, and in the superficial fascia we will able to say loose layer of connective tissue consists of some blood vessels and nerve plexus, and also in the superficial fascia you will able to see some subcutaneous muscles also. Subcutaneous muscles are also seen in the superficial fascia. Okay, and coming to the deep fascia. Okay, coming to the deep fascia, this deep fascia, it is very thick. If compared to the superficial fascia, this deep fascia is very thick and extensive, and it is consists of extensive amount of connective tissue fibers. Okay, and the deep fascia which surrounds the muscles, the deep fascia which surrounds the muscles, and the deep fascia which surrounds, which divides the muscles into various septa. So intermuscular septa are seen in the arm which divides the muscles into groups. Okay, intermuscular septa, which are nothing but the formations of the deep fascia which divides the muscles into groups, and also this deep fascia it forms retinacula on the extensor surface as well as the flexor surface on the plantar aspect of the foot. These deep fascia they form retinacula, they keep the tendons in position, and also this deep fascia is present to enclose the various glands of the body, that is here in the submandibular gland, the deep fascia of neck, it here encloses here the submandibular gland and parotid gland, thus forming the capsules, false capsules of the salivary glands, and the fascia, the deep fascia it forms the roof of the some triangles of the neck here, and the thyroid gland, the deep fascia here it encloses the thyroid gland. So the deep fascia it has various parts. Okay, it forms intermuscular septa in the limbs and in the upper limb and the lower limb, and also retinacula here in the palmar aspect as well as the here in the plantar aspect, in the palmar aspect as well as the plantar aspect. On the extensor retinacula and flexor retinacula they keep the tendons in position, and also this deep fascia we know that in the deep fascia of neck we have investing layer of deep cervical fascia, and also pretracheal fascia is present, and also carotid sheath is present. So we know that the carotid, this deep fascia it surrounds the arteries also, and carotid sheath is the best example which surrounds the common carotid artery and internal jugular vein and the vagus nerve by forming a sheath around it, that is the deep fascia. And the deep fascia it forms connective tissue around the muscle. The connective tissue around the muscle we call this as epimysium, and the connective tissue around the muscle bundles, the connective tissue around the muscle fiber bundles we call it as perimysium, and the connective tissue which surrounds the which connects each muscle fiber we call it as endomysium. So the deep fascia which covers the muscles also we call them as perimysium, epimysium and endomysium, and this deep fascia it also surrounds the nerve fibers also we call it as epineurium and endoneurium also. Each the deep fascia which surrounds each nerve fiber we call it as endoneurium. So these are the different modifications of the deep fascia. So skin, superficial fascia and deep fascia. Coming to the functions of the skin. What are the functions of the skin? So skin is the largest organ of the body, we know that. Okay, so skin it protects the body from various bacterial infections. Okay, skin protects the body from various bacterial infection and ultraviolet rays of the sun. And also skin absorbs various, since it is a good absorber. Okay, skin absorbs the creams, oils. When we apply on the skin, skin absorbs the creams and oils. And skin excretes waste materials. Skin excretes waste materials like through sweat, and also secretes sweat, oil, and also skin it synthesizes vitamin D. Okay, synthesizes vitamin D. These are the various functions of the skin. So absorption takes place through the skin. When we apply the creams and oils, they are easily absorbed into the skin. And this is a protective covering which protects our body through bacterial infections. It is the largest organ of the body. It synthesizes vitamin D and it excretes waste material through sweat. Okay. And one more important thing I have discussed, in the epidermis we will able to see sweat glands and sebaceous glands are present. These sebaceous glands they secrete oil substance called sebum. Okay, and in the epidermis we will able to see hairs and hair, and then they are nothing but the keratin, consists of keratin protein. And one more thing is about the sweat glands. The sweat glands are of two types, eccrine gland and apocrine glands. Apocrine glands they are present all over the body, and the eccrine glands, apocrine glands and eccrine glands. The sweat glands are of two types, apocrine glands and eccrine glands. Okay. Sweat glands are the two types, apocrine glands and eccrine glands. These apocrine glands they can be seen all over the body. They are more abundant in all over the body. And eccrine glands they are seen in specified areas like axilla, perineum region, and the around this, surround the sweat glands, this eccrine gland, they surround the nipple area and also perineal region, and they surround the scrotal region. So they are present, groin region, these eccrine glands, they are present in certain areas of the body, and these eccrine glands, they secrete a characteristic odor. They secrete a sweat which consists of characteristic odor, and these apocrine glands, they are present everywhere, more abundant in everywhere in the body. Okay, so that's about the eccrine glands and the apocrine glands of the body. So that's about the skin and fascia, the brief introduction about the skin and the fascia. Okay, so that's all for the skin and fascia. The skin consists of superficial epidermis and dermis. Epidermis is the avascular layer and dermis is the vascular layer, and then the fascia consists of superficial and fascia and deep fascia. Superficial fascia is a root areolar fascia, and it consists of blood vessels, nerve plexus, and subcutaneous muscles are also present in the superficial fascia, which takes origin from the superficial fascia. And deep fascia, it is very thick, and it divides the muscles by forming intermuscular septa and also retinacula. They keep the tendons in position, and also the deep fascia encloses the various glands of the body, and these are that's about the deep fascia. And the skin occupies 1.5 to 2 square meters of the body. And one more thing is the skin acts as a protective organ. It synthesizes vitamin D12 and it excretes waste materials through sweat, and also it secretes oil also. And one more thing is, the one more important thing is, it synthesizes vitamin D. These are the functions, and it acts as a great absorber by absorbing oil and cream substances. So skin also plays an important role in absorption. So that's all about the skin and fascia.